Hello, and thank you for joining us. Today, we will be talking about medication adherence and how it's about much more than just taking your medicine. My name is Erin McCreary.
And my name's Katie Renna.
And we'll be your presenters. We have nothing to disclose regarding this presentation or the content enclosed. This webinar is part one of a three-part medication adherence webinar series. It is brought to you by the Pharmacy Society of Wisconsin Adherence Competence Collaborative, or PACT. The three-part webinar series will guide pharmacists through a stepwise process that fosters development of the essential skills necessary to conduct an effective medication adherence encounter. Pharmacists will learn and leverage motivational interviewing principles in order to connect with patients in a meaningful, impactful manner. Highlights of the webinar include an overview of the PSW Adherence Pocketbook Toolkit, insight on key questions and solutions that can improve medication adherence, and ideas on how to apply adherence strategies in various practice settings. Before we get started, we wanted to direct you to the PSW website. So if you're at your computer, you can go to www.pswi.org, and along the top toolbar, if you click on the Resources tab, there's a second tab called the PSW Adherence Competence Collaborative. That will bring you to the page shown on your screen. From there, in the bottom right corner, you can see this Resources for Your Practice tab. That will link you to the Adherence Toolkit, as well as to supplemental materials that we'll talk about throughout the presentation that you can use with your patients at your pharmacy. After today, you should be able to define adherence and its impact on quality metrics, healthcare costs, and patient outcomes. You should also be able to describe the PSW Adherence Competence Collaborative and identify the core elements of an adherence encounter. And finally, you should be able to determine the 5 main barriers to medication adherence. So what is adherence? It's important for us to define that before we go further. By definition, adherence is the extent that a person's behavior corresponds with agreed upon recommendations from their healthcare provider. Now, we know in practice that those don't often correlate or agree very well with what doctors tell patients to do and what patients are actually doing. And so that naturally begs the question of, well, why does adherence matter? Well, quite simply, drugs don't work in patients who don't take them. We cannot optimize pharmacotherapy and do our jobs as pharmacists if there are no kinetics or dynamics happening in the patient. Non-adherence is a huge problem in healthcare, and it carries a large cost, both for patients and for the healthcare system. Non-adherence leads to poor patient outcomes because without their medications, they are either being partially treated or not treated at all. Additionally, payers are starting to understand the importance of adherence, and non-adherence could significantly impact you and your pharmacy and reimbursement rates. What do the numbers say about non-adherence? Well, an astonishing 50 to 80% of adults are non-adherent to their treatment regimens per some studies done in the last 10 years. This results in an economic burden of $100 to $300 billion in what we consider avoidable healthcare costs. Because of the significant burden of non-adherence has on patient outcomes and healthcare costs, there has been a lot of research done in recent years to find a solution to this problem. Recently as early in 2017, the Remind study was published, which looked at various medication reminder devices to see if any improved adherence occurred as a result of these devices. Patients were randomized either to usual care or to receive one of 3 reminder devices. So they received either a pill box, a toggle strip on a pill bottle indicating if the daily dose was taken, and this is what's indicated in the top right corner of your screen. Or they received a pill cap that had a digital timer to indicate the time that had lapsed since the last opening of the bottle. Ultimately, this study found that providing medication reminder devices alone did not improve adherence when compared with usual care. So that suggests that non-adherence is a multifactorial problem that requires a pharmacist and other members of the healthcare team to help the patient tackle it. Although pill boxes and reminders are good options and good solutions for some patients, we will discuss throughout this webinar that there is much more to non-adherence than a patient simply just forgetting to take their meds. There was another study and an accompanying editorial that was published in the Journal of the American Medical Association that described almost 40 years worth of adherence research. The authors concluded that, quote, complex, multi-component, behaviorally oriented interventions are needed to bring about substantial change, end quote. Unfortunately, patient-oriented adherence interventions are not routine parts of our practice, and the integration of such interventions in our clinical practice remains an unfulfilled promise. But as seen in these studies, medication adherence does have a significant impact on patients, and it does not have a one-size-fits-all solution. There is no magic pill. Instead, we need to focus our efforts on behavior-changing techniques and interventions to improve adherence and ultimately improve patient outcomes. As pharmacists, we should own medication adherence. We are truly uniquely positioned to help bridge the gap between prescribers and our patients' actions. We are the trusted medication experts within the healthcare team, and therefore we build long-term relationships with our patients and can help them manage their medications. Pharmacists should be prepared to employ patient-oriented adherence interventions in all clinical practice settings. And to do this, we need to be able to identify adherence issues and provide solutions for our patients at every phase of care. This is where the PSW Adherence Competence Collaborative comes into play. PACT is a joint initiative between PSW and residents from around the state of Wisconsin to help pharmacists develop the essential skills needed to conduct effective adherence encounters and to assist patients in successfully managing their medications. PACT is unique in that community and inpatient residents, as well as ambulatory residents, are all a part of this collaborative. PACT's vision is for Wisconsin to have the most adherence patients in the nation, and our motto, of course, is Go PACT Go. The Adherence Pocketbook Toolkit was originally created by the Wisconsin Pharmacy Quality Collaborative and has undergone revisions by PACT members. The toolkit creates a stepwise approach to help pharmacists conduct effective conversations about non-adherence. The toolkit, which hopefully you have in front of you, is broken down into several different sections. It begins by discussing strategies for effective communication, strategies for conducting an adherence encounter, and then finally it goes through the adherence barriers. We'll spend the rest of this webinar identifying the core elements of an adherence encounter and discussing the 5 main barriers to medication adherence. The toolkit utilizes various mnemonics to help us work through adherence encounters. The Motivates mnemonic provides tips on effective communication strategies. The adherence encounter has been broken down into 3 core elements with rhyming names to help you remember the purpose of each section. And lastly, SMURF is a mnemonic to help you remember the 5 main adherence barriers. This webinar will focus on number 1, the strategy for conducting an adherence encounter. Before we dive into this, I want you to turn your attention to the back of the toolkit by flipping it over. So as you turn the toolkit over, you will see the adherence encounter workflow. We apologize that it's a little small on the screen. We also recognize that there are time constraints within some of your practice sites, and it might not be realistic to have a complete adherence encounter at each one, or to be able to go through each aspect of an adherence encounter every time you interact with a patient. Therefore, each color of this encounter workflow could represent a different patient interaction. The workflow breaks down the adherence encounter into 5-minute segments, which makes it more applicable into the pharmacy workplace. Each segment is accompanied with supplemental handouts, which again are available on the PSW website. We will show you some of the supplemental materials later in this webinar as well. As mentioned before, here are the adherence encounters broken down into the 3 core elements, named with the purpose of each in mind. The 3 core elements are assess and address, motivate and negotiate, and solve and involve.
During the first part of the adherence encounter, we should assess and address the situation. So start by gathering basic health and demographic information about the patient. Then determine a patient's willingness to discuss their adherence pattern or assess their readiness to change. And finally, attempt to identify the patient's adherence barriers using open-ended questions that target each barrier. Some examples of these questions have been provided under each adherence barrier section within the toolkit. This is a screenshot of one of the supplemental materials that's available on the PSW website. It's making the most of my medications, and it's a screening tool that may be useful when gathering some of this basic information during the assess and address portion of the adherence encounter. So these are just good standard questions to get the patient thinking about their medication adherence habits. Additionally, this screening tool frees you up to complete other tasks while the patient is thinking about their answers. And you can use this to identify if a patient-oriented adherence intervention is warranted and to gauge the patient's willingness to change. There are 5 main barriers that have been identified to impact adherence. These include system, motivation, understanding, recall, and financial, and together they create the friendly mnemonic SMURF. It is important to note that no one barrier is mutually exclusive of the others, and the toolkit provides examples of opening and follow-up questions to utilize during the assess and address and motivate and negotiate portions of the adherence encounter. It also does provide a few solutions for each barrier to offer as interventions to improve adherence. So like we said before, this webinar will focus on defining adherence and to provide you with the tools to elicit these barriers from patients. So now we will go into more detail to define and help you identify certain adherence barriers. So the first one is system barriers, which involve transportation, access, and social and economic factors such as age, race, and socioeconomic status. For example, some patients may not be independent and may rely on family members to take them to doctor's appointments or a caregiver to help them set up a medication box. All of these factors come into play when discussing a patient's adherence, and it's a good idea to ask patients about their ease of travel and how they manage their medications. The second adherence barrier is motivation. And this is a crucial barrier to overcome in order to empower the patient to take charge of their own care. Patients with motivational adherence barriers suffer from adverse effects from their medications or are not seeing the benefits of these medications right away or at all. For example, a patient beginning an SSRI therapy may lack motivation to continue treatment because they are not seeing the effect yet. Asking questions like, do you feel your medication is helping or harming you? Or how important do you feel it is to treat your diabetes or hypertension? This opens the conversation for discussion about the benefits of medications, monitoring strategies, and goals of care. Identifying goals of care will often generate motivation for the patient to want to achieve these goals. Assessing a patient's motivation can often give you a glimpse into a patient's understanding of their health status and medications. We can use the 3' questions to gauge basic understanding. However, oftentimes additional questions are necessary to truly understand where the patient's knowledge gaps are. So here are some key questions that will allow you to assess the patient's understanding. Asking patients how they like to receive instruction. So do they like to be told, or would they prefer written materials? Do they want their information down in a chart? Will often tell us how this patient is understanding their health information. And we can also gauge their health literacy by how they refer to their medication. So do they refer to it as the water pill or the little white one? Can give us a glimpse as to their understanding of their medication or their health status. The next adherence barrier we'll discuss is recall. And this is probably the barrier that comes to mind when thinking about adherence, although it might not be the most common one. So how do we figure out if recall is the issue? A good question to ask may be, thinking over the past 2 weeks, how many days did you forget to take your medicine? Putting that time frame in the question makes it easier for patients to answer. And don't forget to use your resources. So review their refill history, and that can clue you in as to how long a medication supply is lasting a patient. Is that new twice a day medication lasting them 60 days instead of 30? We can ask the patient if there are specific times of day that may be easier or more difficult for them to remember to take their medication. And then a good follow-up question would be to ask if they've tried any medication reminder tools. If the patient has tried, say, a medication reminder application, this tells us that they recognize that there is a problem and are already trying to fix it. And the last adherence barrier to discuss is financial. And this can be a difficult barrier to discuss because oftentimes patients are embarrassed to admit that they can't afford their medications. So asking questions like, how often do you skip doses to make a medication last longer? Or how many times a month do you spend less on basic needs in order to pay for medications? This opens up the conversation without actually accusing patients of not being able to afford their medications. Financial barriers can be especially frustrating for patients because they actually want to take their medications but just can't afford it. And because of this, it is even more important we motivate these patients. So back to our strategy for conducting an adherence encounter. The second core element is motivate and negotiate. And during this part of the encounter, you want to utilize the motivates mnemonic to reinforce positive behaviors and negotiate avenues of change for the patient. The motivate and negotiate, as well as motivational interviewing, will be further discussed in webinar 2. And the third core element of an adherence encounter is solve and involve. So this is where you want to work with the patient to select an adherence strategy and a follow-up plan. So ask patients what they're willing to try or changes they are willing to make. And last but not least, stay involved with them. So be sure and follow up to assess knowledge or skills you taught them and congratulate them on their progress. And some solution examples will be further discussed in webinar 3. And this concludes this first webinar. The next webinar will discuss motivational interviewing, and the third webinar will provide examples of how to bring patient-oriented adherence interventions into clinical practice. We want to thank you for listening, and we hope you enjoyed the content today, and you also join in on the other webinars. Please feel free to send either Erin or myself an email if you have any questions regarding the content in this webinar.